Good morning, my name is Lindsay and I'm a medical assistant here at Cheng Plastics, and today I'm undergoing a lower blepharoplasty with Dr. Elbert Cheng. We're doing fat grafting as well as some CO2 lasering. Hi everyone, just wanted to give you a quick update on my surgical journey. Today I am day 1 post-op from lower blepharoplasty, CO2 lasering, resurfacing, as well as fat transfer. I feel great today. I was able to shower, which was awesome. Not wearing any makeup or anything, obviously. I'm cleaning my incisions and my CO2 lasering about 4 times a day and applying a little erythromycin along the incision line here, as well as the elastin recovery balm to my CO2 lasering sites. I do have some injection sites here. That's where the fat transfer was injected. I'm just cleaning that with a little hydrogen peroxide and applying some bacitracin. No pain, really. I haven't had to take any pain medication, which is great. I feel really good. I do have some swelling, as you can see, and tomorrow will probably be even a little bit more swelling. The swelling is causing a little bit of tugging on my lower lid. That's completely normal, and I know that'll go away. I'm combating that with some icing. I'm icing for about 15-20 minutes on and then off, and then again 15-20 minutes on. And I have some blurry vision as well, which is probably from the swelling, as well as the ointments that I have to put in my eyes, some antibacterial ointments. But other than that, I'm great. I mean, I wouldn't drive a car today or anything, but I can do some light housework around the house. I'm trying to keep my heart rate below 80 beats per minute, so no, activities, physical activities, no heavy lifting, things like that. But I definitely feel like myself, so. All right, I'll keep you guys updated. Hi everybody, we're at day 4 post-op, lower bleph. So today I have some swelling still, a little bit of bruising you can see, but it's yellowing, so that means it's on its way out. I have a little bit of redness from the CO2 lasering. I'm still pretty swollen. I'm icing every day. And I have a little bit of tugging here just from the swelling. It's kind of pulling a little bit, but I'm super happy so far. I love the fullness. I wish it would all stay. And yeah, I'm doing really well. I'm applying, I'm still cleaning 4 times a day. I'm still eating pineapple and papaya just to reduce swelling. I'm sleeping elevated, and this is my first day back at work, and my eyes are a little tired. I'm about halfway through my shift, but other than that, I'm doing really, really well, so yay. So I'm gonna kind of go over what I experienced as a patient the morning of surgery. So I got up kind of early. I live in Santa Cruz, so we had to drive over the hill. We got here, I took a shower, I HIPAA cleansed, got really clean, no lotions, no nothing, kept all my valuables at home. Arrived in the morning, I buzzed the back door. Ashley, the RN, let me in, and she had me sign some consents. We did some photos. She went over everything that I can expect. She spoke with my caregiver about aftercare, what was needed, if I needed to get any extra supplies that we forgot. And then Dr. Elbert came in, he gave me some medications, and I felt a little loopy for a little bit. And then we went ahead and he did drawings on my face. We discussed the plan again very thoroughly. We went over it a couple times from consult to surgery date. So we were all on the same page about what I wanted, and keeping my expectations realistic as well. So that was really important to me. I was definitely a little nervous. My blood pressure was a little elevated, which is normally pretty low. But during surgery, I did not do general anesthesia, and part of me does kind of regret that because it is kind of painful, and I remember some of that. So depending on your pain tolerance, I don't know, you could either go that route or not go that route. But it was, yeah, I mean, I would do it again in a heartbeat. I'm so happy with the results so far, and I was really taken care of here. So I appreciate everybody, all the staff. Hi everyone, today I am post-op day 7. I just had my sutures removed yesterday, and I was very nervous about that whole process, and luckily...
Hi, Lindsay. Woo, look at you.
I had my sutures removed yesterday. I was a little nervous about having them removed. I was worried it was gonna hurt. There were parts that were like a little stingy, I wanna say, and maybe you can kind of feel the tugging. But other than that, it was really good. My eyes did water a little bit. I already am starting to look so much better just having the sutures out. Everything just seems less aggravated and inflamed. It just looks a lot smoother. My CO2 is pretty much healed for the most part. I'm obviously wearing a hat and sunglasses when I'm outside, protecting that area. I'm still a little swollen, but not as bad as I have been, so it's really, really good. Most people don't even notice now when I wear my glasses. It's pretty easy to camouflage that I've had something done. So yeah, and I'm really happy with the results thus far. I think it's really, really life-changing.
I mean, Lindsay is 1 week after surgery and she looks great. You know, usually when we have patients like with eyelid surgery, one side or one eye typically heals a little faster than the other side, and that's pretty much typical and happening with Lindsay. I think her right eye healed faster, or is healing faster than the left eye. But yeah, we contoured some fat from an inside approach, and we did some lasering, we did some fat grafting around her cheeks, and took a little pinch of skin from the lower eyelid. So yeah, she's doing great. The only thing for Lindsay now is we're trying to hold her back from, she wants to run 5 miles and then she wants to, like, you know, do all these like exercises. She's super active, and that's what we have to just kind of temper that a little bit.
I'm listening.
Sure.
Sorry.